Well, hello, and welcome back to Trans Truth. I'm your host, Kelly Nelson, she, her, hers, joined as always by my co-host.
I'm Jerry Ann, and my pronouns are also she, her, and hers.
And joining us today is Dr. Jessica Zweiner from Braeswood Endocrinology here in Houston. Say hello to our listeners, Dr. Zweiner.
Hello, everyone. Thank you for having me.
And thank you for joining us. We just chatted briefly about all the things we want to talk about, and I assured Dr. Zweiner that we're going to get to all of that. But I'm gonna open up to ask you about the clinic, how you came to be affiliated with it, what's its mission.
So I have a small private practice called Braeswood Endocrinology. I'm an endocrinologist, and we take care of transgender and gender diverse patients. It's a good question on how I got into this. I've always thought gender was interesting, but never really figured I could do anything with it. I read an article in college about surgeries on intersex babies, and it was the first time I'd ever heard of intersex as a topic. I thought it was fascinating, but I knew I didn't want to be a surgeon, so I kind of put it out of my mind. And as I went through med school, I realized I liked internal medicine, and then I did endocrinology and realized at the end of that, endocrinologists are supposed to take care of transgender folks. And we didn't have any training for that in my program, but I learned it myself, learned from my patients. And then when I started my clinic, I didn't think I would attract that many trans folks. I thought I'd be doing mostly diabetes and thyroids, and then just have a couple of people I got to take care of. And luckily for me, the only people who have been coming have been trans folks. And it's the greatest clinic to work at. It's, people are happy to come.
So
go ahead.
Well, so you basically formed your practice with the mission of serving the trans community right from the start. Is that fair to say?
That was always the goal. I didn't think it would be possible. So I didn't explicitly market myself as, we only take care of trans people. But word spread, and this is exactly what I hoped what I wanted, but never thought I'd be able to have.
How old is your practice?
We started in the beginning of 2017 and grew very, very slowly. I just had my first child and was figuring out how to take care of a kid and start a practice and all of that, how to balance it all. But we were probably running full swing by beginning of 2019. We brought on Todd O'Neill, our nurse practitioner, in early 2020, January of 2020. Then I've been going strong ever since.
I had no idea that it was that new. The people I've talked to, the people that I've talked to about gender affirming healthcare resources, speak like it's the only game in town.
There aren't that many places to get gender affirming care, which is surprising because we live in Houston. And I know it's Texas, it's a red state, but we've got 4 million people that live here. Legacy is big, but there's always availability issues. Sometimes it's hard to get appointments in a reasonable time period. Who else? There's a couple of bigger places. There's not very many.
Yeah. How big is your practice? How many patients?
Right now we have about 800 people between Todd and I that we take care of.
That's amazing in such a short time. It sounds big. Was that success surprising?
It was. A lot of these small practices that start up have a really hard time finding patients and marketing to patients, and have to spend a lot of time, with advertising and talking to people, talking to primary care doctors, trying to get referrals. And, I did all that stuff for a few months. And ever since then, we haven't had to do anything. People just come to us.
Well, you timed it right, because now you're able to capitalize on that transgender fad.
Yes, that's exactly why we started this practice. I saw that, trans people were the coolest new thing on TikTok and had to cash in on it.
Jerry Ann and I often joke that they're everywhere.
I mean, it has been interesting, even just in the 6 years that I've been doing this, to see how people's stories have changed. When I started, I was still getting people coming in and saying, well, I socially transitioned. It went pretty well. I mean, I got fired, but I found another job. And, I lost half of my family, but not all of them. And now people come in and they're like, oh, yeah, I came out at work. So what else is new? It was just another Tuesday.
Yes.
There's so much more support. I think a lot of it is just visibility. There's so many fewer explanations. You can just announce that you're trans and you don't have to then explain what that means. And because people they're aware, they've met trans folks before. It's not brand new.
Well, that we talk about that a lot, and especially when questions come up about that transgender agenda thing, and the accusations of grooming and all of that, and I don't. Well, we know I've done the research.
Mm-hmm.
It's not that there are more of us. It's that we are more visible. It's more acceptable, so people feel safer, to be themselves. And oh my God, that's now alarming.
I have a good number of patients who have started their hormones in their 60s and 70s. And the stories are almost all the same. I've known this since I was a kid. I was told early on that was not acceptable. I spent the next 50 years attempting to suppress it and finally realized that I can't. So here I am. These aren't people who are on TikTok who decided yesterday that, maybe it would be fun if I, took some hormones.
Well, you're talking to two of them.
It's just for anybody that actually knows trans people, it's just so obvious. I don't know.
Elaborate on that. Obviously, you know a lot of trans people, but what is it that's obvious?
Just that this is the right decision. This is a normal state of being. This is part of the normal diversity of the human condition. This is not somebody deciding or realizing that they're trans and needing hormones is not a fad. It's not because people are depressed or schizophrenic or psychotic or whatever.
This is normal. It is a normal segment on that curve of, of all people. Unusual to be sure, but not abnormal.
Not common, but not wrong. There's nothing wrong with it. I think the other thing is just being able to watch so many patients go through hormones. The before and after is just mind-blowing, and not just the physical changes, but people's mental health. I take so many people off their antidepressants. But also just watching people go from being isolated, being, afraid, maybe not afraid, but not safe to be themselves, to becoming more confident, seeing a future for themselves, getting, better jobs, standing up for themselves, leaving toxic relationships. The benefits are just
I was going to ask about some of the effects of hormone therapy, including the psychoactive effects that some people allege. But since you brought it up, let's jump right in. We hear a lot that, I took my first dose of estrogen today, and it's like the veil has been lifted on my world. What's going on there? I mean, it's that response is common enough, but it's not a psychoactive drug. But what's really happening?
We don't have specific data about this is exactly why mental health changes, or we don't know really specific stuff. I mean, we don't know specifics of exactly what happens in the brain for much of anything psychiatric. Um, but it's interesting there are short-term effects and long-term effects. When you take your first dose of hormones, be it estrogen or testosterone, there is definitely a component of, yes, oh my God, I'm finally here. It's not psychoactive. It's just, you're excited because you wanted it for a long time.
Yeah.
But there is something physiologic about this stuff. We don't know why people are trans, and it's probably multifactorial. But one of the things that has been posited that looks like it has some decent data behind it is your brain structure is either male or female, or somewhere along that spectrum.
Mm-hmm.
There are gender differences, and if you have a feminine brain and a masculine body, that brain needs estrogen. It feels better with estrogen. Again, this is not from a randomized controlled trial. It's just from experience based on working with so many folks. But people will report it as, I feel like myself. I finally feel right. This is what's been missing from my life. I feel complete. It's just that piece of something was missing. One patient described it as the world was black and white and now it's in color. There's this whole other dimension that I hadn't even known about. And it's just so cool to be able to help people out like that, to make such a big change.
Well, it's so cool that people like yourself have found that mission so rewarding. We want to thank you for bringing that to the community.
Well, of course, I have the easy part. I get to talk to people and write some prescriptions and see how great everything goes.
Yeah.
Yeah.
Tell us about the demographics of your 800 or so patients. What's the most common age and gender identity?
So most people identify as binary trans, either male or female.
Mm-hmm.
I probably have more trans women than trans men in the practice, just because it's easier to get testosterone from like a regular doctor that doesn't know much about gender affirming care.
Really?
Yeah, it's dosed the same way as it is for cisgender men with low testosterone.
Uh-huh.
And lots of cis guys are on testosterone because they like testosterone. With trans women, the hormones are a little bit more complicated. There's multiple hormones, multiple formulations, and a lot of doctors don't have much training in giving hormone replacement to women. When I was in training, we were stopping everybody's postmenopausal hormone replacement because the big women's health study that had just come out saying that it was going to kill us all.
Yeah, I remember that.
Yeah, so there's this. Doctors usually have a little bit less experience with managing estrogen and progesterone. But yeah, I'd say we have mostly binary trans folks. We do have some non-binary folks. People's gender identity does sometimes evolve from, binary to non-binary or the other way around, as people just become more in tune with what their gender identity really is. We have quite a few folks in their 20s, just because that's usually when you are free from your parents, you have a job, you have enough money to even think about going to a doctor and getting medications. You've had time to figure out your gender identity. I do have a wide range of people. Prior to the ban on care for minors, I think I've had people from 15 all the way up to 75, 70 something. We talked about some of my older patients who come in their 60s and 70s needing to start. We've got some, 30s, 40s, 50-year-olds, all races, all religions, lots of neurodiversity. ADHD and autism are very, very common, and trans folks, and as such, are very common in our clinic. Does that kind of answer the question?
Yeah. You mentioned the non-binary patients.
Mm-hmm.
What are they looking for when they come to Braeswood Endocrinology?
Well, everybody's different.
Ah,
Most
okay.
people are looking, everybody coming to our clinic is looking for hormones because that's,
Sure.
what we do. Um, with every patient, I ask, what are your goals? What do you not want? And then how do we get there? And for most folks, if you're binary, um, male or female, it's pretty easy. If you're starting estrogen, most everybody wants the same stuff. I want breast growth. I want, fat redistribution. I want softer skin.
Hmm.
All of that stuff. For non-binary folks, it's highly variable. People can want all sorts of different things. And so we talk about what their body looks like now, what they want it to look like, and how we get there. So sometimes hormones are a good solution. Sometimes hormones actually wouldn't be a good solution. And then we talk about surgeries or legal name and gender marker change or, various other ways that people can express their gender a little bit differently.
Okay.
With one, go ahead.
Does that variation in goals dictate a different treatment approach? I mean,
Oh, definitely.
if somebody says, I just want to be a little bit more feminine, do they
Mm-hmm.
take a different dose? Tell us about that.
Some people like to have just a lower dose. They want changes to go more slowly, or they don't want them to be quite as obvious. Some people will say things like, if they're assigned female at birth and want to masculinize some, they'll say, I want my voice to drop just a little bit so that people can't gender me on the phone. But I don't want anything else. And so in that case, we do a lower dose of testosterone. We go just until the voice is where they want it to be, and then we stop. Some
Interesting.
people, there's all different things that people that are important. Some people on testosterone really don't want facial hair, and so we can go until they get some facial hair. Some people on estrogen either want a lot of breast development or want to avoid breast development or want only a little bit or only enough that they could hide it in a binder on more masculine days. So it really is just personalized. People tell me what they want, and I figure out how to get them there, and then we just check in periodically to make sure we're still moving in the right direction.
Let's talk about expectations. What's a realistic expectation for either a male to female or a female to male patient when they start hormone therapy?
Isn't that the $1 million question? It's hard to know because everyone does respond to hormones so differently. I have some people who, just huge changes in just a few months. I have some people where they, even after a few years on estrogen, they're not seeing much breast development. Beard growth for trans men, that can come immediately, that can come a decade later. It's so highly variable. One thing that I do see a lot of online is people telling trans women in particular not to get your hopes up because you're never going to, look as good as cis women do or get, have the breast development that cis women do. And I think, you don't want to overpromise, but you don't want to underpromise either. I think a lot of people, trans women in particular in this country, are given low to medium dose estrogen pills and high dose spironolactone. And if you don't ever get enough estrogen, of course you're not going to get the development that you're looking for.
Yep.
But with a more effective regimen, particularly if someone's willing to go on injections, then usually we can get pretty good results.
Jerry, what is it you always tell people about the efficacy of a pill when it comes to breast growth?
I can't remember specifically what you're referring to.
The other industry that would be threatened?
Oh, yeah. Sure. If you could develop a centerfold body by taking some pills or sticking yourself with a needle, it would put plastic surgeons out of business. There's over 400,000 breast augmentations every year in this country.
Oh, goodness.
But you probably can hope for enough extra growth to help the plastic surgeons someday.
Well, and it's a different calculation for everybody. We look at how big you want to be, how big you are, what your time course is. Do you want to wait around for 5 years to see what you get with hormones? finances, since this is America.
Yeah.
Yeah, what determines a person's response? One person very little response, and someone else, decent response. What
I have
determines
no idea.
Okay.
No idea. Uh, I mean, obviously, your choice of hormones and your dose will have, a decent effect. But, I have some patients, you can put them on two people on the same dose, the same regimen, and one will have, C cup breasts in a year, and the other one might, still be trying to fill out an A cup in 3 years. I don't know. Body fat percentage does have some role to play in breast and hip development. If you're very, very thin, you don't have much fat, or if you're actively losing weight, it's going to go slower, trying to build those new organs.
So have you seen a correlation between breast growth and adipose tissue?
So with cis women and trans women, breasts are made of fat. So any weight change is going to be reflected in the breasts as well as the rest of the body. So if you lose 100 pounds, you're probably going to look fabulous, but your breasts are probably going to decrease in size as well. If you gain 20 pounds, a lot of people are complaining about that because they're not happy that their pants don't fit. But, on the upside, their breasts got bigger, so they needed new bras.
You touched briefly on the bans that we're seeing being put in place by ill-informed politicians. I'm on my soapbox already. Don't get me started.
I will join you up there.
Yeah. Okay. Let's talk about that. Invariably, those bills are discussed and pitched as protecting children. We don't believe that. I'm guessing you don't either.
I'm very, very much against these bans. I do not think they protect children.
Why is that? What's the danger in not providing gender-affirming care to minor patients?
I mean, the big thing is suicide risk. And the right, the Republicans, they get annoyed when we bring up suicide risk, and they'll try and quote studies that, it's only suicidal ideation, not completed suicide, or it doesn't actually increase it. The number of trans folks who have thought about or attempted suicide is astronomical. I mean, the studies that we look at usually quote 40 to 70% of people have at least thought about it. When I was in med school, they always told us to ask about suicide history, but most of us never did, because if you're looking at the general population, suicide attempts are a couple of percent of the population, and it was just not anything that was relevant. When I asked my trans folks, it's 50 to 75% of people have either thought about it or attempted.
Yeah, and that's as you say, that's a staggering number.
It's huge.
And suicidal ideation is, when we're talking about depression, is a significant clinical finding, and one which a caregiver ignores at their peril. So
it blew me away the first time I heard one of the legislators say something about, it's just suicidal ideation. It doesn't really matter.
Right.
What?
So much ignorance out there.
Oh, yes. So mental health is a huge reason. So aside from suicide, just watching these kids, they do so much better when they are able to be themselves and be recognized as themselves. They do better in school. They have better interpersonal relationships. I've had kids tell me that they can plan a future now. They hadn't realized that, they were not trying in school, not wanting to go to college, or working in dead-end jobs or something, because they couldn't picture a future for themselves in their birth-assigned sex. But once they started on hormones, they could see a future for themselves. They could imagine what they would look like at 50. And it was this one kiddo described it as the pieces just kind of fell into place. If I want to get there, I need to, do well in school. I have a reason to do well in school. It's just a huge change in these kids. Another reason that it's so important to treat minors is that you might be able to use puberty blockers, which block the effects of your first puberty.
Of course.
These drugs are fabulous. And it's something that a lot of the politicians don't seem to understand. I mean, it sounds reasonable, but we're not against trans people, but just wait until you're 18 to start
Yeah.
treatment. And that
And
sounds
they
reasonable.
just
but,
don't get it.
right. But you'd never tell a kid with cancer that, this chemotherapy might make you infertile. So let's just wait till you're 18 and you can make that decision on your own. See, for trans women, trans girls, trans women in particular, the ability to not grow facial hair can save you tens of thousands of dollars, hundreds of hours of electrolysis.
Tell us about it.
Oh my gosh, Dr. Zweiner, that was is it Zweiner or Zweiner?
Zweiner.
Zweiner, okay. Facial hair was so traumatic for me that I found an electrologist in the 70s, in the early 70s, and I completed electrolysis before I was 30.
Oh goodness.
And I will be 73 in a couple of weeks. That was a long time ago, but yeah, that facial hair is traumatic. It's tragic.
And it's something that I never really understood until I started working with so many patients. Because, as a cis person in med school, we focus on kind of obvious things or life-threatening things or whatever. So I would always I went into this thinking, oh, well, genitals, that's obviously the biggest thing. Everybody's going to want vaginoplasty and, facial hair, whatever, that's just laser. It's fine. It's not a big deal. And then I got to meet people and my patients taught me a lot. And just seeing how much of an issue electrolysis is, I mean, it's expensive and it's painful and it takes forever. And if you work weekdays and you need to go on weekends and you have to grow the hair out for a few days beforehand, then you're having to spend all of your time at work with, facial hair growing out, which is
it's inconvenient
it's terrible
in many different ways. It's inconvenient, expensive, painful. And it leaves some lasting damage. You just can't stick an electric needle in your skin a gazillion times and get away with that scot-free. So, but let me step aside from strictly medical talk and let me ask you about relationships. You see, I'm sure, married people, and in particular, male to female trans people that come in with a spouse. What do you see happening with relationships? Now, let me just tell you where I'm coming from. I tried to cure myself twice with love and marriage, and it didn't work either time. And in my case, the relationship was over, and I'm a hated individual, and the poison was passed on to extended family and community and friends and everything else. I actually had to move and relocate. It was so bad. But what do you see in terms of relationship? Do couples stay together? Does it vary?
It is all over the map. Every couple is different. And so if we're going to stick with a trans woman married to a cis woman, some couples choose to stay together. I've had some patients where the cis wife, when being told that the partner is trans, has said, oh, well, I'm bisexual, so that's fine. Great, what's for dinner? Kind of moves on like that. Some people they want to stay together because they have a long-term relationship, or they have kids, or financially it makes sense, or they love each other platonically, but they don't want to blow up their lives. Some people realize that, I still love you, but I'm not a lesbian, so we need to divorce and still be amicable. And then sometimes there's cases like yours where the spouse is angry, hostile, turns everybody against them. Sometimes it works out really nicely. Sometimes it's messy. Sometimes, even if both sides want to stay together, if your sexualities aren't compatible, then, sometimes there's not much else you can do.
Let me ask you this. In your experience, does there appear to be one or a handful, a few determining factors in a relationship that cause it to go one way or another?
I would say the strength of the relationship prior to transition is important. I mean, obviously, that's going to decrease risk of divorce anyway. But the ability to communicate, having couples who actually love each other and are not, just kind of holding each other in contempt all the time, or feeling contempt for each other. Also, open-mindedness and community support. So if somebody is living in a small town in a red area of the state, it's going to be a lot more difficult for them to stick together than if they're living in Montrose and all of their friends are blue. Then they might be looked down on for breaking up instead of staying together.
Well, thank you for sharing your thoughts on that.
And of course.
Kelly?
Yeah, right at the top, you mentioned, 2 or 3 categories of things to talk about, and one of those was personal experience. Is there anything in particular you wanted to share?
I think we've talked about a lot of stuff.
Okay.
I just meant when I said that, not things that aren't really data, just stuff that I've learned through experience.
Okay. Well, we are running close to the time limit that I promised. So, is there anything else that you would like to share that we haven't touched on?
I don't think so. You two have a bunch of really good questions. This was a really fun time talking.
Well, we are very pleased that you were able to join us. Once again, we've been talking with Dr. Jessica Zweiner from the Braeswood Endocrinology Clinic. And if any of our listeners are searching for a caregiver when it comes to transgender hormone therapy, I can highly recommend Braeswood Endocrinology.
Well, thank you for your kind words.
Okay.
Thank you so much.
Thank you for your time, Dr. Zweiner.
Of course. Thank you so much for having me on. It was wonderful to talk to you both.
You have been listening to Trans Truth, the podcast that speaks the truth about what it means to be transgender. If you are a transgender yourself, you have a friend or loved one who is transgender, or if you are simply looking to understand more about the transgender experience, we hope that you have found this episode to be informative and enlightening. If you have any questions or comments, please feel free to contact us at info@transtruth.info. Copyright 2023 Trans Truth.